I remember even prior to being in medical school, and this might have been 20 or more years ago, that we would see on the Discovery Channel, or I can't even remember, maybe in Popular Science or something, where they're talking about some of these far-out technologies that the NASA was doing with the astronauts, trying to do remote monitoring, and the idea of maybe being able to do robotic surgery on astronauts, or take care of astronauts that are thousands and thousands of miles away remotely. And I say, wow, that's pretty cool. But you know, that technology is now here now. And so that we're using robots in the operating room. Kaiser Permanente urologists are using robotic surgery. I do medical mission work. I've gone on trips to India and Myanmar, and mostly my focus is in Central America, in Guatemala. And there's projects going on in different sites in the world where there actually is an example. I'll give you an example that I'm aware of in Mexico, where plastic surgeons were doing cleft lip and palate repair. But they were doing the pre-op evaluations via satellite video. So they were in the United States. The patients were obviously in Mexico, but using satellite telephone video technology, they were examining the patients remotely, had the pre-op done, would fly down to Mexico, do the operations, fly back to the United States, and do the post-op follow-up via, again, satellite video phone. So that is an example of what could be happening to bring health care to people that normally do not have health care. So that technology is now, but it's still limited. We still haven't been able to take it from the gee-whiz, high-tech tertiary care hospitals to the more rural environments where it can maybe be used even to a wider audience than we're able to do right now. And going back to kind of the gee-whiz stuff from years ago, you know, NASA is talking about developing and have developed gloves that relay the sensation back to a physician on Earth while the astronaut's in orbit. So we just talked about remote monitoring of stethoscopes that can hear heart sounds and breath sounds for many miles away. Imagine being able to use one of these virtual reality gloves, and I can actually do the physical exam and touch the patient and be located many miles away. I might be able to be here at a Kaiser Permanente home office here in Denver and be able to examine somebody down in rural Colorado, out on the western slope or on the eastern plains, and be able to actually touch, not only hear and see, but actually touch the patient.